Hey there, I'm Maddie Gardner at the WBTV News Now desk. We are waiting on a press conference to get underway with Mecklenburg County. They're giving us an update about COVID-19 cases as the county reaches 32% of tests coming back positive. We just got the 30-second warning. They are about to give an update. We will be hearing from the new health director, Dr. Raynard Washington, as well as representatives from Novant Health, Atrium Health, and StarMed Healthcare. So we are going to be listening into that and giving you that update live right here. So stand by. We are going to bring that up for you now.
At this time, I'd like to turn the meeting over to Mecklenburg County Health Director, Dr. Raynard Washington. Dr. Washington.
Thank you. Good afternoon, everybody. Thank you for joining us here for this virtual media update. I'm very happy to be joined by a few of our colleagues and key partners, Dr. Sid Fletcher from Novant, Dr. Jim Hunter from Atrium Health, as well as Dr. Mike Estramonte from StarMed Healthcare. Just wanted to provide an update for the community on a number of key aspects of our COVID-19 conditions and response. As you probably saw from our data release today, we are continuing to experience the impact of the Omicron variant here locally in Mecklenburg County. All of our key indicators are higher than they've ever been at this point. Our case counts are really high. We're seeing several thousand cases per day. Certainly our percent positivity is over 33% for the last week. And we are starting to see a pretty significant increase in the number of folks requiring hospitalization with COVID-19. As many people are aware and know, our testing demand continues to be at really incredibly high levels. That is certainly having an impact on all of our healthcare providers. And I just want to take a moment to just say thank you just to everyone that's in this work with us together, our healthcare systems, our partners at StarMed, all of our testing providers in the community. We are not shielded from the impact of COVID-19, our workforces, our staff members. And so we are feeling the strain and the stress of this current surge. And certainly want to just thank you to everyone who's working on the ground every day to do this work to help our community stay safe and, of course, protect the most vulnerable in this community. Of course, as I was just saying, we are seeing transmission at levels we have not seen before. We are hopeful that this surge will start to cool off in the next several weeks. But right now, we're sort of in the thick of it. I did want to provide a quick update on our sequencing activities in partnership with UNC Charlotte. Our latest report does verify or indicate that roughly 74% of our cases right now are the Omicron variant. This is, of course, something that we're not surprised by. We are expecting that this variant was predominant right now in terms of what's transmitting in our community. And so we would anticipate probably that next week that number will be a little bit higher because these were for samples that were collected about a week and a half ago. And so at this time, we're expecting that Omicron will probably completely be the strain that's circulating right now. A couple of other updates. I'll let our hospitals talk shortly about sort of their operating status. But as I mentioned, they are seeing an increase in utilization. The good news is we're not seeing that same impact in the intensive care units at this time, which is likely related to the fact that we've got a pretty high level of vaccination in our community. And that is a really important part of the equation for us, as well as we have access to treatments in the community. And so we're encouraging folks, one, to make sure you get vaccinated, make sure you get boosted. And if you have a diagnosis and start to feel sick, to seek out testing and treatment. One other update on testing. We are just a little bit ago, we released a press release. As you all know, we've been waiting for a really large shipment of rapid test kits. That shipment has arrived. Our staff are working right now to unpack and sort and to distribute those test kits so that we can prepare to distribute them to the community. Given the high demand right now we have for testing in the community, we're going to have sort of a mass distribution tomorrow so that people can more quickly access that resource and we can serve more people at 2 large sites versus the smaller sites at the libraries. So we will be tomorrow, Saturday, from 10 to 2 o'clock p.m. at Bojangles Coliseum and at Philip O'Berry Academy of Technology on the west side. We're asking folks to please, you will not be able to come into the testing pickup area until 10 o'clock. So do not arrive early. There is no reason to come at 7 or 6 in the morning. There will not be a line available. There will be law enforcement presence to make sure folks don't start to wait early. Just come at 10 o'clock. We have a large number of test kits available. We're hopeful that we're able to distribute upwards of 20,000 tests tomorrow. So we have some supply, but please don't come early. And in the spirit of safety for our residents in those communities and for the folks coming to get it, to receive test kits, please make sure that you're come in between those hours. If we have to stay a little bit late, we will do that tomorrow, but please don't come early because it certainly creates a safety challenge for us. The last thing I'll say relative to the distribution, we have a lot of folks in our community who are experiencing symptoms that are like COVID-like symptoms, and a lot of folks who've been exposed. So please, if you don't need to take a test right now, please don't come to a testing site or to pick up test kits tomorrow. We really want to reserve these resources for folks who are sick, experiencing symptoms, or absolutely need to utilize take a COVID-19 test. We know the wait times are long and stressful. We ask for folks' patience as we're working as best we can to set up some new sites, potentially even larger sites in the coming days. And so we're doing all we can. And again, I can't thank our partners enough for working alongside us to make testing as widely available as possible. Lastly, of course, I'll close with before I pass it to the hospital staff, with just acknowledging that vaccinations are important. They're critical. The majority of the folks in the hospital are unvaccinated. The majority of folks who are requiring ventilation or intensive care are folks who have yet to be vaccinated. And so we really have got to not distract from that message that we really need folks in our community to do their part and go ahead and come on in and get your vaccination and your boosters on time so that we can continue to do the things that we know are important. So with that, I'll pass it to Dr. Fletcher and then to Dr. Hunter for a quick update on the hospital status, and then we'll open the floor for questions.
Hey, good afternoon, everyone. This is Sid Fletcher. I'm the Chief Clinical Officer with Novant Health. Appreciate Dr. Washington's remarks. I would just start by saying we certainly, just like last week when we talked, we've got rising numbers in the ED and within the hospital. We are starting to see some more ICU follow through, which is not unexpected, right? We always know that there's a lag time directly related to that. To Dr. Washington's earlier comment, last week when we talked about unvaccinated versus those vaccinated that are hospitalized, we told you that the number was, at least within the Novant system, was around 80% that were, unvaccinated that were admitted. We now have actually changed that up to say, hey, what about those that are what we're going to term under-vaccinated, meaning the group that either they've gotten, prior J&J, Moderna, or Pfizer, but they're really past the window where they could receive a booster and they have not. So if you actually include them, 96% of the people that are admitted to our facilities are either unvaccinated or under-vaccinated. And currently in the ICU on a ventilator, 100% of those patients fall in that category as well. So what that tells us is really vaccines and boosters work, and it's important for you to hear that message. We continue to use the surge plans that we have had, and I think we're working hard there. We continue still to see a large number of patients that are seeking testing. So, great news from the county that they have these rapid tests and are going to be able to distribute them. We have worked hard at trying to expand our hours of operation as well for testing because, we get it. It's been difficult to try to find that as a resource for testing. I'm hoping that that's going to help, and I guess we'll see what else happens in terms of ability to get those rapid tests over the counter or at local pharmacies as well. Lastly, I would just tell you our teams are really tired, and I think for months we've appreciated the public calling them heroes, but just remember they're moms and dads, brothers and sisters, and they've got family and friends that they care about and that they need to take care of in their environment, and they can get sick just like everybody else. So what I would say is we've been asking for a long time. We know that telling you to get a vaccine doesn't work. So I'm going to just say we're begging you, please get vaccinated if you have not been vaccinated. It's critical. We need you to do that. If you're eligible for a booster, please get a booster because, our teams have loved you calling them heroes, but they're tired and they really need some relief. And with that, I'll turn it over to Dr. Hunter. Thanks.
Great. Thank you very much. I'm Jim Hunter. I'm the Chief Medical Officer for the Atrium Health Enterprise. First, our numbers are rising just as everyone else's is. Our staff is also experiencing increased illness with the Omicron variant, we presume for most of that. And so those numbers are up. Our message from Atrium Health is that we're going to get through this. We're better prepared than we were 2 years ago by a vast amount. We have a federally approved, safe and effective vaccine, boosters. We have medications. We know more about how this spreads and how to treat it. And even with the challenges that we have with the increased numbers and illnesses of the staff, we've got an incredible set of teammates here. We've got over 70,000 teammates at Atrium Health. Their resilience has been impressive over the past 2 years. And we have plans, and we are executing on those plans to make sure that we can care for the sick people that need it in our community and do it in a safe, efficient, and high quality way. So the last thing is, again, I will also echo the vaccines. The vaccines are important. The boosters are important. Please do that. Please do not come to the emergency departments for tests or for non-serious illnesses. There are lots of other options out there to have your needs met. So with that, I'll pause, and Dr. Washington, turn it back to you.
Thank you. And let me just also sort of echo the begging. We are begging at this point. We need folks to get vaccinated so that our hospitals can continue to serve those in our community that have urgent health issues, folks with car accidents, any other kind of injury, or heart attacks or strokes. We need the space and the healthcare resources to do that. And so we're asking folks to do their part and help us. We are a community, and I also echo the sentiment that we will get through this surge. We are prepared, as prepared as possible. The last thing I'll say is for folks who are in the long testing lines, our partners across the county at the healthcare systems at StarMed are working to increase capacity as much as possible. So we're asking people to be patient. We are looking at a number of alternative sites that we're hoping to be able to either relocate some sites or expand capacity at new sites to be able to deal with some of the traffic issues. But remember, these folks are doing their jobs to help serve us as a community. So please be patient, please be kind. We are a community. We all have a role to play here. And so just asking folks to help us in that as we work to mobilize additional resources as quickly as possible. So with that, I'll open the floor for questions. And
Thank you, Dr. Washington. First question today is Joe Bruno, WSOC TV.
Hello, everyone. Dr. Washington, welcome to the job. What a time to join. But thank you for organizing this. Two questions. One, I think everyone can kind of chime in on, and the other is for StarMed. Monoclonal antibodies, it's the treatment for COVID-19, one of them. Really tough to find right now. Yesterday, I was looking in Jacksonville, North Carolina, was like the only place StarMed had open slots for. I understand that there's only really one monoclonal antibody treatment that is effective against Omicron. What steps would you suggest for someone who's positive and needs this treatment? And are you guys having conversations about getting more of this treatment in Mecklenburg County? The other question is about the StarMount testing location specifically. A lot of neighbors are at their wits' end. We had that really scary incident a couple days ago. Is that one of the test sites that you are looking at possibly moving?
yeah, so on the first question, let me just say globally, the monoclonal antibody treatments, the supply of those is being provided by the federal government through our state. And so we are really at the local level, in many ways, receiving our supply from our partners at the state. And the shortages are not unique to Mecklenburg County. It's across the entire state, as you've commented on. And that really is based on delays and supply chain and development delays from a federal perspective. And so I know our partners are anticipating and have put in requests for additional supply. But if the supply is not there, we can't get it. And so we're waiting to hear more about when we'll have additional supply. and recognize that that is an important part of the equation, and particularly as we think about our hospital capacity. Dr. Mike, you want to respond to the South Boulevard?
Sure. We do have some good news. I was actually out there today, and we just locked in a contract to be able to go down to the Archdale station on Monday. So that site it will open on Monday unless there's any unforeseens, but we will be operating. We're operating today, Saturday, and Sunday out of that site.
Next question is Chloe Leshner, WCNC.
Hi, everybody. Thanks so much. This is for Dr. Washington about the at-home tests. How many did you all get, and will they all be given out tomorrow at those 2 locations, or will you have them back in those libraries and some of the health department sites too?
Sure. Yeah, we received roughly 24,000. We had to actually utilize some for other high priority situations. Unfortunately, our partners at the state do not have a supply at this moment. So we've been having to divert some of those resources to some high priority settings, including our first responders, the detention center, and some other high priority our shelters as well. So some of those will be allocated for those settings who have urgent needs as well, which are typically supplied by the state, but unfortunately don't have a supply right now. And then we will be distributing as many as possible tomorrow. Like I said, we're going to send a large volume to each of those 2 sites and get through as much as possible. We hope to reopen the library program early next week, but more will come on that depending on how things go on Saturday. We want to be careful with our library partners and our libraries, given the level of demand. We just want to make sure if we can do mass events to get more volume out. That's what we're going to do for right now.
Next question, Brett Jensen, WBT Radio.
I know I asked you guys last week a variant of this question about capacity levels in ICU with COVID patients. I know last week, Atrium, 24% of your patients in Mecklenburg County had COVID in ICU. And then this week, it's raised 16 more patients to 34%, or 57 patients of your 168 beds are COVID positive. It seems like a small increase considering that they're at 34% positivity rate. Is it simply just to the straight fact, the fact that it is vaccinations that is keeping these numbers down compared to last year, and also the fact that Omicron's not quite as impactful? I mean, is it as simple as that?
Yeah, we think so. But what I will caution is certainly the rapid spread of Omicron. It's been exponential. And so typically hospitalizations lag behind, community level transmission. And so I think we'll be watching, and I know our hospital partners are watching really closely volumes as they're coming in over the next several weeks. But given that we had such a really rapid rise in cases and transmission, you would anticipate a little bit of a lag in terms of what you see in the hospitals. So it's something to watch closely, but we are cautiously optimistic that truly the vaccines are working. I think as you heard from our hospital partners, the overwhelming majority of their inpatients are folks who have yet to be vaccinated, which is a testament to the effectiveness of these vaccines.
And real quick, for the Dr. Hunter and Dr. Fletcher, in terms of the ICU patients that you guys are seeing, do you guys have are these people that are generally that have underlying health conditions that are in the ICU, even if they are vaccinated? Or is there a particular age range that you guys are seeing?
So I'll go ahead and start with that. Certainly there's a mixture, there is a complete mixture of patients, but two things stand out. One is the lack of vaccination or being boosted. Two is the fact that they frequently have comorbid conditions, so other health illnesses that make them more at risk. And three, the age for the Omicron ICU patient is significantly less than it was during our Delta surge. So these are younger patients that are coming in than what we saw before. And lastly, we have less of these patients on ventilators as a percentage than what we did before. Why that is, I think Dr. Washington touched on it. I think it's multifactorial. It's probably the Omicron itself. It's the vaccination status. It's the better treatments and more knowledge about the disease all rolled together. And I can't tell you exactly which one of those contribute, but I think the mixture is what explains it.
Yeah, this is Dr. Fletcher. That's a great synopsis. And I would also say that people that are hospitalized that aren't in the ICU tend to have a little less oxygen requirement than we'd seen previously, especially with Delta. And I would say that we have an expectation, and we have seen a little bit less flow to the intensive care unit as well. So again, likelihood of a combination of many, many factors. Those that are in the hospital that are under-vaccinated tend to be an older population. So our average age that we saw was around 77 for those who, again, had quote, a breakthrough case. And what I mean by that is somebody who didn't get their booster, but they had received the original vaccination. And the group that is completely unvaccinated tends to be a younger population within the hospital walls.
Next question is Drew Belia, WCCB.
Thank you. My main question was already answered, but just wanted to get some clarification from Dr. Estramante about when you'll be moving that testing site in the Starmount.
Sure. As I mentioned, we're going to test right through the weekend through Sunday, and then Sunday afternoon we're going to pack up all of our materials and be ready to go Monday morning at 9 a.m.
Thank you.
Next question is Claire Donnelly, WFAE.
Hi, everybody. Thanks for doing this. I wanted to know, Dr. Washington, whether the county health department plans to mandate booster shots for county health department employees and maybe county employees at large.
Sure, Claire. At this time, we are not mandating boosters for county employees or health department employees. At this time, we are, of course, encouraging our employees to go get their booster shots and obviously making opportunities available for them to do so.
Next question is Chloe Leshner, WCNC.
Thank you. Mike, I guess we are hearing on Twitter that the link that you all put out for people who still haven't gotten their results isn't working yet. So I guess when should people expect to get those results for their tests if they haven't yet?
Sure. No, thanks. And I wanted to thank everybody in the media for being understanding. We did have a technical issue that occurred. We discovered it yesterday morning. It's been identified and resolved. What we're waiting for now is the interface between the lab and the resulting software. There's a lag, and as that data is getting pushed over, people are getting their results currently. So to your question right now, with that link being broken, it's being repaired as we speak in real time. And as far as to give broader context, the amount of people that were affected. It appears, I mean, we've done close to nearly 1 million COVID tests since the onset, and right now our volume went from 4,000 a week to about 40,000 a week. So I believe it was around 3,800 that were impacted by this, so instead of getting the results within the 48-hour time frame turnaround time that we were currently experiencing, they pushed past that 72, and so. We're still identifying. We've increased our call center because our call center went up by 2.5 times with this recent issue. So we're doing everything we can. There's all hands are on deck right now to resolve this. But for context, it's I'm not saying it's a small number because one is unacceptable, especially when you're dealing with an immunocompromised patient that needs their test result. So I can tell you nobody's resting at StarMed until everybody gets their results.
Next question, Robin Kennedy, Fox 46.
Hi, thank you. I have 2 questions. How much is testing supply the issue, or is it more just demand, or both? How much of each? And then also, would you all advise companies to incentivize vaccines and boosters?
So on the first front, it's certainly really a demand issue, as you just heard Dr. Mike say. Our weekly testing demand, is up 7 to 10 times as much as it had been previously, which is a large amount. That's really consequential for the entire system, both in terms of the sites that are doing specimen collection and the laboratory that has to process those specimens on the back end. And so it really is a huge impact. We have a lot of testing capacity in Mecklenburg County, particularly relative to other areas, we have a lot of sites. We have lots of pharmacy locations. We have all of our community testing sites, our urgent cares. We have our healthcare systems that are providing additional mass testing sites. So there's lots of supply, but we have just an unprecedented demand at this time. And one other important point I'll make is, Mecklenburg sits in the middle of a region. And so we do have a lot of residents of other counties who are coming into Mecklenburg County to access resources that may not be as accessible in their community. And so that puts additional strain on the resources that we have available here. And on the final note relative to requiring or incentivizing vaccines, we certainly encourage businesses, employers, and other entities to require or incentivize their employees to get the COVID-19 vaccine. Again, as you've heard us say multiple times, COVID is here. It's not going anywhere. We're not on the path to eradication. And so people are going to need those additional tools to help them stay healthy as we learn to live with COVID in our community.
Next question. Let's go back to Brett Jensen, WBT Radio.
Thanks. Earlier this week, Charlotte Catholic High School and its entire private school system announced that they were going to go virtual for about a week, even though they were stayed open all of last year. They never went virtual. And a couple of charter schools and other magnet schools are going virtual for a week or two, simply because they just don't have teachers, substitutes, because it's the teachers that are getting this and they just don't have enough teachers. What are and I'd love to hear this from HM and Novon as well, but also you, Dr. Washington. What's your stance right now for CMS in terms of staying open for the kids?
Sure. So I believe in-person education is a high priority for us in this community, really across the country. We are working very closely with our partners in CMS to provide every support possible to assist them to be able to keep kids in classrooms across the county. And so we continue to advise them to obviously continue full in-person learning. And of course, there will be circumstances or situations where we'll have to make decisions about individual classrooms, potentially more than one classroom, or maybe even an entire one campus, but as an entire system, advising them to continue to utilize the tools we have at our disposal to keep kids in classrooms. We have provided a lot of support to CMS and are working really closely with them. They are been great partners in that effort. We have over 140 school-based coordinators that public health has hired and trained to place in each of the schools, and we're still working to hire more so every school can have one of those. And they really provide additional support to the administration on contact tracing, testing resources, and connecting families to resources that they may need. And so we're continuing to work closely with them, as well as we just had a call with their leadership team this morning, just staying in close contact as implementation moves forward. It's important that families know if your kid is sick, you need to keep them home. We should not be sending kids who have sickness or have symptoms, or especially those that are COVID-like, into the classroom, because that is what's going to be the greatest risk of us transmitting, having transmission in the school setting. Parents, please do your part talking to your kids about keeping their mask on in school. And of course, we anticipate CMS is going to have workforce impact just like every other organization in this county. And so they're working to be able to obviously mitigate those, shortages in staff and bus drivers and other roles as much as possible. And so we'll keep everyone posted as we progress.
Next question is Katie Soloff, Axios, Charlotte.
Good afternoon, everyone. This question can be for any of the healthcare professionals on the line today. Based on the trends that we are seeing in Mecklenburg County, when do you anticipate the current Omicron wave surge to peak in Mecklenburg County?
I joked the other day and told someone that Gibby didn't leave me a crystal ball. We certainly don't know for certain when we'll hit the peak of this. We are still seeing pretty high case counts based on what we've seen in other countries who are a little bit further ahead in this pandemic, and based on our experience last year with our post-holiday surge, we are hopeful that we start to see some reprieve in the next couple of weeks, but certainly no guarantee there, but that's our best guess.
Yeah, this is Sid Fletcher. I would just say, we have predictive models that we look at, and certainly, those models show that it's going to continue up over the next several weeks. think one of the things we haven't seen as much of, though, with this surge, the amount of community positivity in the testing is way, way up over where we've ever seen that before. So what impact that could have to the rise and fall of that curve is currently unknown, to Dr. Washington's point.
Next question, let's go back to Joe Bruno, WSOC TV.
So with this monoclonal antibody shortage, if you are a high-risk patient and you get COVID-19, what is your recommendation since this treatment is hard to come by? Are there other treatments out there that people can receive? Like, is that pill ready to launch? Can you just tell me what people should do since it's really tough to find this treatment for them?
I guess a global comment to that, and I'll defer to others to jump in if they have any remarks, is, folks should make contact with their healthcare provider. That is the most sort of critical thing you can do if you're not feeling well, and then particularly if you're high risk and you have a COVID infection, is to be in touch with your healthcare provider. Every individual patient's circumstances are different, and certainly the circumstances could lead to different guidance based on that patient's condition.
Next question, Robin Kanady, Fox 46.
Hi, this is for Atrium and Novant. You all said that you have experienced staff, of course, as all of us have, with increased illness. Can you give us any numbers, on how much staff has been impacted and been out with COVID?
So at Atrium Health, of course, our teammates are part of the community, and as the community gets ill, of course, our teammates are out there, and they have illness as well. Rest assured, we've been here before. We have plans for this. We can pull in travelers. We can redeploy our staff. We use our virtual care capabilities. We've got our hospital at home to do that. So we can be more efficient. We can keep the quality high, and with 70,000 teammates, we're able to do this with a lot more magnitude, than some places can. So there's no specific numbers to share, but we definitely have the plans there. Just because we're such a part of the community, we can community to do their part, be safe, get vaccinated, get boosted, wear your masks, and then don't come to our emergency departments unless you've got a serious illness. Don't call 911 unless you have a serious illness. You can go to your primary care doctor or an urgent care.
Yeah, one of the things I would say is that certainly we've seen this rise as we've seen the community rise, to Dr. Hunter's point. So the numbers are going up for our team members. One of the things to remember, though, also is that we have a mandatory vaccine of our team members, so they tend to be less sick. And with the new CDC guidance, that's allowed us to get some team members who are completely asymptomatic back to work a little bit earlier, which I think will be very impactful just in terms of having an ability to really have many people available. We also, to Dr. Hunter's other point, we're a big organization. We can bring other resources to bear, and we also have travelers and others that can help support the team. And we've gone through similar surges where we've had team members out. Thanks.
And do you all plan to mandate boosters? Why or why not?
So at Atrium Health, that we already have the initial vaccine mandate. Certainly, we encourage our teammates to get boosted as soon as they're eligible. We certainly encourage our community to get boosted whenever they are eligible. At this point in time, we're not mandating boosters at Atrium Health.
Similar for us, it's been mandatory since the end of October for our team members. And I think at this point, we have not mandated that the boosters themselves are required. Thanks.
Next question, Chloe Leshner, WCNC.
We saw a little bit during the Delta surge that it encouraged some people to go and get vaccinated. Have any of you noticed that with Omicron, more people coming out to get the shots?
Yeah, thanks, Chloe. Great question. Not as many more as we would hope or would like to see, but I do think there are some of our vaccine partners are experiencing some delays in uploading data into the system. And so we don't have just yet a great picture of the last few weeks of vaccines because it's been just an incredible, all resources are deployed to the immediate needs to provide services to people. But we will obviously take a close look at that and keep you posted if we do see an appreciable increase in the number of vaccines that have been administered in the last couple of weeks. Again, I would encourage folks, though, to certainly do that. I mean, it is important. This is, I think it's clear to all of us how quickly COVID can spread. This is very different than has happened previously. I guarantee there's nobody on this call that doesn't know someone with COVID right now. And with that being the case, I think it should be a message for everyone in the community that COVID is real, it's serious, it's not just going to go away. And we all should do what we can to protect ourselves and those that we love.
Thank you, Dr. Washington. Floor is now open for follow-up questions. Any further questions today?
Hey, this is Katie again from Axios. I just wanted to understand better the thinking, the logic behind why such large employers are not requiring boosters when vaccines are required. I mean, based just on that hospitalization data alone, the fact that those who come into the hospital sick with COVID are under-vaccinated, as well as those in the ICU are under-vaccinated. I'm just curious to understand why one and not the other. It seems as if the booster provides the full protection against serious illness for folks.
So, Katie, I'll just say, we are certainly discussing implementing additional requirements with not just the county, but all folks who are making these decisions and considering the impact of this. So I don't think it's not a matter of we're not ever going to have to do that, but it's just not a decision point that's been made at this time, both across the county and the key partners. We do anticipate at some point that potentially as we learn more about the impact of boosters, the need for boosters in the short and the long term, that we'll be able to make more informed decisions about the requirements relative to booster shots.
Next question, please. Any further questions today? Thank you. I'll turn it back over to Dr. Washington to close the availability. Thank you.
Sure. Well, thank you guys for joining us today. We will continue to provide updates as information changes and the situation evolves. So thank you all very much and have a happy weekend.
So you're just listening in to health leaders in Mecklenburg County give an update on COVID-19 as 32% of tests are now coming back positive in the county. We also learned of opportunities this weekend in Mecklenburg County to get an at-home test kit. I'm putting that information up on your screen right now if you'd like to take a screenshot of this or write it down. So this is happening tomorrow. That's January 8th. From 10 a.m. until 2 p.m. for Mecklenburg County residents. They are handing out at-home test kits at Philip O'Berry Academy of Technology and also at Bojangles Coliseum. Again, that starts at 10 o'clock tomorrow. And Health Director Dr. Raynard Washington was saying, don't show up early. Don't try to get in line early. They're not letting people in until 10 o'clock tomorrow morning. So there's no need to try to get in line for one of those test kits. Again, that is only for Mecklenburg County residents. They have a couple thousand test kits to give out. So if you need one of those, once again, I'll put that information up for you. This is happening from 10 until 2 at Philip O'Berry Academy of Technology and Bojangles Coliseum. As always, you can find the latest COVID-19 information, all of the stories that we've done on COVID-19 and our vaccine team right now on WBTV.com. You can also stream those stories wherever you stream WBTV News Now, whether that's Roku, Amazon Fire, Apple TV, or WBTV.com/live. Thanks for joining us this afternoon. We are going to be live at 3 o'clock with QC at 3.